Welcome. Thank you so much for joining us today live or on the recording for episode 12 of Dr. Jeff Talks About Sex and Intimacy, Beyond Penetration, Exploring the World of Outercourse. I am truly humbled and honored that you have taken time to join us. We are on social media. We're out there on Facebook, YouTube, X, and all these social media sites. We really do need 100 followers on Facebook, and then we can stream directly live there. So please, if you are on Facebook, please follow us there. That would be awesome because we're already recorded there, but we will be there live. If you want to know about previous episodes or watch our previous episodes, please go to our website to learn more about previous ones that you can watch recorded on the website, and also about all the amazing, wonderful guests that are coming in the next weeks to come on Dr. Jeff Talks About Sex and Intimacy. Please know that you are welcome here. You are so welcome here. Whatever your sexual orientation, whatever your gender identity, whatever your relationship style, this is a space where you are welcome, and we are so happy that you are here. You know, the goal of this podcast, I try to talk about that each time. It's very simple, and it's to empower and enlighten you with evidence-based scientific information you need to enable you to make informed choices to improve sexual health and to deepen your loving relationship. I don't know about you, but I just think more love is a great thing. So this evening, I am very excited about our topic. You know, in our fast-paced, overcommitted lives, and I've been a doer. I got to do more hustling, trying to do things constantly. It's so easy to get caught up in the societal expectations. Especially it's easy to get caught up in those expectations when it comes to sex. Too often, penetrative sex is seen as the ultimate goal. And it's overshadowing the vast spectrum of pleasure and connection that exists beyond it. But intimacy isn't defined by penetration alone. There are countless ways to experience pleasure through touch, stroking, kissing, caressing, vibration, and so much more. When we expand our view of sexuality, we open the door to deeper connection, enhanced pleasure, and a more fulfilling intimate life. Tonight, we're exploring the rich and diverse world of Outercourse, pleasure beyond penetration. Let's dive in. I am so excited this evening to welcome back Dr. Susan Kellogg-Spadt. She simply is the ultimate expert with decades of experience diagnosing and treating pelvic pain and female sexual dysfunction. She's also a professor and nationally recognized speaker and author. Let's welcome Dr. Susan Kellogg-Spadt.
Hi, Jeff. Hi, everyone. I'm so happy to be back.
I'm so happy you are back. You know, you have so much to share with our audience. And tonight, I know we're both really excited about this topic. And I think there's so much to unpack and explore. So thank you for being here once again.
My pleasure indeed. You know, I think another great subtitle for this is, why is intercourse overrated? Because it really is, you know, there's so many reasons it's overrated. So let's just kind of think about that. When you, both Jeff and I see patients in clinical practice, and I think that we both often will talk about alternatives to penetration for couples who are having whatever trouble with penetration. They are having sexual pain if they're a woman, or they're having erection difficulties if they're a man. And all intercourse means for that cadre of person is just pressure. Am I gonna size up? Excuse the pun. Am I gonna be able to perform? Am I gonna do it the right way? You know, but who gets to define the right way? It looks like society has defined the right way, or so we think. Okay, they've given us bases, haven't they, Jeff? Like, you do this, you do that, you do a little touch, and then you do a little lower touch, and so there's this like unbelievably defined script of how we as human beings are supposed to have normal sex. And the truth is, it sets up crazy expectations for not measuring up, right? And don't tell me for one, I'll go first. I will admit that there have been moments when I wondered, am I measuring up? Am I doing this right? Especially boy, in the earlier years, you're thinking, oh, you're dating, you're like, oh my God, I don't even know if I'm doing this right. Why is there no manual? And anyway, so it kind of sets us up to fail. It sets us up to hold ourselves against a standard that is really artificially created. And I don't actually even know why. So let's think about pleasure for a minute. You mentioned pleasure. You're very good at mentioning pleasure, Jeff. And if the goal of sex beyond procreation, by the way, if the goal of sex beyond procreation is an exchange of pleasure between two people, then why can't it be pleasurable or fun? Why can't we giggle or laugh or mess up a little bit or get really kind of fun and think about things? So with that in mind tonight, we're going to have a very open dialogue about outercourse or non-penetrative play. And we're going to talk about some kind of crazy fun ideas that you might want to bring into your own relationship or just actually explore with yourself or just put them away in your memory bank for the next time you're with someone or with a group of people. And so I am going to actually ask Jeff to kind of put me on the spot to name a couple of outercourse techniques that we recommend. Jeff and I both recommend techniques to patients, and they kind of look at us like, wait, really? But some of them might appeal to you and some might not, but they're ideas to have fun, share pleasure, and it doesn't involve a penis in a vagina particularly. And it can involve any, as Jeff said in the intro, any genders with kind of no boundaries. Now, this is not necessarily, I don't know what your definition of kink is or whatever. It's not really that per se. It's just simply opening up your mind to possibilities. So Jeff, let's say we're in a restaurant together and I say, oh, well, the rules of society dictate in this restaurant, if it's after 5 o'clock, we can only eat steak. I mean, that's what Americans do, right? They eat steak after 5 o'clock. And you say, Suze, that is the most ridiculous thing I've ever heard. There's on this menu, there's shrimp and there's chicken and there's salads and there's tacos. And no. You're in America and you are a man over the age of 18 and you must eat a steak because it's after 5 o'clock. It's the most ridiculous thing we've ever heard of, right? Mm-hmm. But what we've done as a culture, and it's not just American, it's all over the world. What we've done as a culture is really say, well, if you're a grown-up person and you're having sex looks like, sounds like this. It's in this tiny little box. It's defined usually in the closest, most narrow sense of the word, penis and vagina, intercourse, penetrative play. So I'd like to, I guess, really kind of blow that thought out of the water and say, outercourse is probably a time to have endless possibilities and endless fun and really start to see what gives you pleasure and how you can give pleasure to others if that's your goal.
I think too, Susan, you bring up an excellent point. And what if steak is taken off the menu? Like, for example, I know, I'm in my 60s, my wife is too, and you come to a place where you're like, wow, this is getting uncomfortable. I have a problem. And so how are we going to be sexual together? So even what happens with a lot of us is it's taken off the menu, maybe temporarily, maybe permanently, whatever. But then now, what do we do when that's not even on the menu anymore? I mean, because honestly, so many people go through this, and we in our own struggles, as Julie and I, it's just like maybe too much information, but it's like we all go through it as we get older. If you get to a certain point, you probably will go through too these issues with it's uncomfortable, the dryness, the different things. What else can we do? So
exactly. Yeah. And back to the restaurant thing, steaks off the menu. I say, well, that's okay, Jeff. You don't have to eat for the rest of your life after 5 o'clock. Well, that's kind of preposterous, isn't it? But what a lot of couples really struggle with is when that end game is taken off the menu because of disability, or whether it be temporary or permanent illness, inability to do kind of what you want to do because of blood flow issues or things like that. When it's taken off the menu, they do starve. they do starve. They say, well, that's off the menu. The menu's closed. The restaurant's closed. It was a lovely 30 years of life with you, darling, and goodbye. We're done now. Not goodbye, but well, maybe goodbye, but whatever. So, and again, the whole restaurant thing sounds ridiculous, but that's what happens to people that don't kind of think. And you know what? It's not their fault if they don't think about it, because what's the first thing that, like, for instance, you come in after having a baby, when the doctor says, okay, no sex for 6 weeks. Does that mean no kissing for 6 weeks? Does that mean I can't have him rub my back in the shower for 6? That's all sex, right? That's all pleasure, right? But so even in our medical communities, they use the word sex to be synonymous with intercourse. And in our earlier conversation, steak would be synonymous with dinner, you see. So it's, if you kind of just think of it in a really big way, that's part of what I see my goal with patients is just to say, okay, if that's not happening for whatever reason, what else could happen?
It doesn't mean your sex life is over, because we both have sat there with people who are like, this part of my life is over now, I guess. One or the other, and the other. Sometimes the partner's like, wait, I don't want to be over. And they may even be like, I don't want to be over either. But the restaurant's closed. The shop is closed. The shop is closed down. It's not, but it's not. And that's the amazing thing about what we both get to do with patients is we get those wonderful aha moments with them where they're like, oh, I'm like, you are 68. Your sex life is nowhere close to being over,
Yeah.
So.
Yeah, absolutely. All right, we're going to start off tonight with just kind of having wild ideas about what you could do if you're not having penis and vagina sex. So let me just start out with one. You could take a shower together. And so you're both nice and clean, and talk about what oral sex, for instance, would look or feel like. And if you're feeling squeamish or out of practice or never had any practice, then maybe you can each get a piece of fruit and demonstrate what optimal oral sex would look like and feel like for you. So for my partner, who happens to be a man, I would say, well, here's a banana, but if you want to use a tomato or whatever, have at it and show me what kind of pleasuring on the banana that you would enjoy. And then I would probably take a peach, because that's kind of my jam, but open a peach and I'd say, well, this is what I would enjoy. And so you end up cracking up. It's hysterical. But these are life lessons that you can take then to the bedroom or into the car or wherever it is you're going to do that. And you can feel a little bit more at ease about sharing oral pleasuring that maybe you haven't done since you were dating. Maybe you haven't done since the baby's been born. Maybe you've never done it at all. And you're like, I am clueless. Well, your partner just gave you a front seat, vision of what they think might really feel good. And they've done it in this completely non-sexual way of, making love to a piece of fruit, but giggle, it all can be so much fun and so pleasurable to do that. So that's my first thought on a fun outer course play exercise that really turns out to be super fun. How about you, Jeff? Do you have any ideas?
I love that. And, and it can be challenging because like one of the couples was like, we were going to switch to something else, but then they recommended, well, it's been a long time, we could have oral sex. And she was like, there are so many different creams down there right now and things going on down there from my problems I'm having. I'm not sure that you're going to want to do that. So I think sometimes you have to be very creative and think out of the box. I think sometimes one thing that I found was kind of fun is a trip to the pleasure chest or to Lover's Lane or any of the above, the Lion's Den, you name it. Kind of some of the people there have so much incredible knowledge about the different things that they have to offer. It's pretty amazing, and they really do want to help people. So I've referred people. I had a person I would refer to at one of those shops up near my clinic. They were so incredibly helpful. And so this couple said, yeah, we went and we got this amazing vibrator that we put between us on the clitoris and the penis at the same time. And it was amazing. I had a gay couple who said, we go there all the time. It's so much fun. We have such a good time going there to find new and fun toys. One really cool thing that happened during COVID, I don't know about you, with my patients was because I was doing these video visits like this and I could see my patients, they could show me their home, their pets, and they would show me they're like, I want to show you this new toy that I got and this new thing that we've been using. And they could show me what it was. And they're like, what do you think? It was great because people got so creative with the different things that they would come up with. But I think a trip to one of those places and finding some fun, interesting toys for each other or both can be a wonderful way to enjoy non-penetrative sex.
Absolutely. You bring up a really good point, because when we're talking to patients, what COVID really helped us do was understand the potential for things to be not so awkward if you're not face to face with somebody and on a video screen or on a phone. Sometimes people feel more playful, more open, less embarrassed, and can see and show things that they ordinarily don't feel like they can do when they're facing someone. That's an idea for Outercourse. Phone sex, for instance. Say the things on the phone. Make a phone conversation with your partner and say, if I were home right now, what I would be doing to you, or I'd like to have you do to me. And you can be really seductive and have really a lot of fun with phone sex and say some kind of outrageous things and not feel anywhere close to the embarrassment or awkwardness that if you were laying in bed next to the partner, those words would be harder to come out of your mouth. Do you know? So think about using media. Think about using a video, or invite your partner to a Zoom conference with you and hop online on Zoom, or just do it on the phone, because it just really can be so much fun. If they travel for a living, that's perfect, because then you can call them in the hotel room late at night and do something like that too. So think about that. That's lovely Outercourse.
Yes. And even I was thinking about, we have the most amazing food here in Chicago, because you've been here.
I do know this. Yes.
When you come, you're always like, I have to have these foods because it's Chicago, because it's so amazing. But we have great Ethiopian food, which of course you eat with your hands. Mm-hmm. You could do takeout Ethiopian, and you could feed each other. It could lead to that food going different places, wherever you would want or whatever you'd want to do. But I think feeding each other can be a really fun, very sensual thing, even if it doesn't involve genitalia, chest, breastplay, or anything. I think just feeding each other. I love too. I talk to people about in the shower. Doesn't it feel wonderful to have somebody like you lay in the bathtub and they wash your hair while you're in the bathtub behind you or something? I mean, what? That's some pretty good stuff, right?
But Jeff, if you're just so busy having penis and vagina sex, you'd never get to these things. You know that, right? So one of the really benefits of Outercourse is that it's so freeing not to follow a script and not to do the things we've always done, thereby also flirting with boredom. I'm just going to say it. It's the same. Okay, it's if I ask any of my girlfriends and any of my patients, how do you know you're about to have sex? They'll say, okay, the teeth are brushing at 3 a.m, or it's da 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 da, and then it's it's like there's a little pat on my butt or a little like rub on my shoulder. It's like we're very much creatures of habit, and what Outercourse begs us to do is break out of those habits and try something fun. So and even for people that don't even have dysfunction of any kind, just to have some fun.
Yes, I had 2 men who came in, and they had very defined script roles in their sex life too, and they were like, well, I'm a top and he's a bottom, and this is how we do everything. But he started having issues, which can happen, and so he's like, there's things where it's like I can't do that right now. I can't really. Penetrative sex isn't comfortable for me on the receiving side. So they were just like, oh my gosh, what are we going to do? And I'm just like, okay, there's so many things that you can do. And so it was interesting, but thinking about, well, now the receiving penetration's not so good, but there's all kinds of amazing ways to mimic penetration too, with your thighs, with different things that rub different places, even rubbing up against The stomach is a very erotic area for some people. So rubbing putting some lubricant there, and him rubbing up against his partner, they found was comfortable. Even he kind of liked different things, and so we just came up with creative ways. From behind, you could rub across the back,
Mhm.
different things that would feel good. But we get into our mind, this is our script, this is how we do it. I touch you here, you touch me there, and then, oh, this is what you like, this is what I like. Are we done? Okay, good. That was great. And the mystery of it is so much fun when we open up to that.
Yep. So I have another one for you. This is actually from sex therapy days, training in sex therapy. This is a technique called hand writing. I'll say it again, hand writing. You know how earlier I talked about using fruit to show your partner what oral pleasuring would be nice for you. Handwriting is when a person takes their own hand to stimulate their own breasts or body or genitals, but the partner rides on top of their hand and gets to be an observer, you see, a passive observer of what cadence feels good. Do you like circular rubbing? Do you like up and down? Do you like me to use a hand like this?
Mm.
And so it's a nice, non-threatening way to learn what your partner likes for manual or hand stimulation. Then on the next time you do it, you trade. And the partner is doing his or her thing to stimulate the part of the body. Again, maybe it's nipples or shoulders or buttocks or anything. And if the partner, let's say that it's a little annoying that their touches maybe is a little bit too fast or it's a little bit too firm, then the person who is writing can do the correction, but not verbally, because that's so
Mm.
hurtful. That can hurt so badly, like slow down. It can be just, you just you ride the hand and just show what feels good, because nobody wants to do something that doesn't feel good. This is a pleasure. But if you're this silent, the strong silent couple that never says anything, then really are we accomplishing anything but play acting?
Mm.
I'm
Mm.
not so sure. So handwriting is a great technique. It's a fun activity to do. And a lot of couples do it. And you just do it back and forth until you kind of get what it is that's really enjoyable.
Mm.
Also, if the person whose body is being stimulated in the first technique is on the bottom, then if anybody on this hand is feeling squeamish about anything, they're not directly touching a part of the body right out of the gate. You understand? They're just on their secondhand knowledge. And so it just feels more comfortable, particularly for couples that maybe haven't done just good old fashioned manual stimulation in a long time, brand new dating couples that don't have any idea what the other person likes, or people who's inserting member like a penis or even fingers in this technique. They don't have to do anything penetrative. It can just be all on the surface, just very non-threatening, but you end up cracking up too because it's pretty fun.
I think laughter is great medicine. And I like the idea of even like doing that writing a little bit, like thinking about creative ways to do that where you're spooning and then your hands are reaching around and both hands are working together on the partner, what feels good and learning and all that kind of thing. I think too, like thinking back, we've had a lot of sexuality training, Susan and I, because we had to go through extensive things, especially our counselor training and stuff was very extensive. And during that, we had to watch a lot of things to desensitize us to all different kink, anything and everything. But one thing I thought was really interesting, I don't know what you thought, I'm sure you saw some of this, was I really enjoyed some of the thoughts about edging. Bringing your partner to the edge, but not quite taking them there, and then slowing down, coming to the edge again, over and over to let that build and build till you hit that very enjoyable orgasm. But I really liked that the concept of edging and building that orgasm through edging.
Absolutely. And I think we're in such a hurry. We're always in such a hurry in this society. And I'll own this one too. Like always in a go. If we finish having sex in 5 minutes, I will get 8 hours of sleep. If we go too long, I'm going to get less than 8 hours. And I don't know how I feel about that. So the other thing is to schedule sex. So let's talk about scheduling sex play. Okay. Because again, it should be called sex play because it should be playful. If you schedule it so that you're clean, I like a clean partner, and I think my partner likes me clean. So if you're clean, you're well hydrated, you are feeling relaxed because it's scheduled, and so there's not a time limit that you have to be finished in like 7 minutes or anything like that. You can really have some fun with outercourse techniques in a more relaxed fashion. So there is nothing unsexy about scheduling sex, because if you schedule sex play, it gets done, doesn't it? Mm-hmm. If you say, well, when I'm relaxed enough, thin enough, on vacation enough, hard enough, wet enough, blah, blah, blah enough, then those enoughs just don't happen, do they?
Or even the end of the day thing too, right? So many of my couples they have an aha moment with, because they're just like, but by the time we get in bed, we're so tired. Of course, we both have children. We both raise children. You get to that end of the day. By the time, Julie always says, 2 seconds after you lay your head down, you're asleep. So that may not be the time for really good, engaged love, sex play and love play. So I think your scheduling idea, and I've had so many people say, oh, we always have sex at bedtime. I'm like, try a nooner, try morning. Everybody gets a shower or in the shower. Showers are great when you have children and you're like, okay, how are we going to do this? So we can be a little creative. There's so many things that can be done. So I love scheduling.
So Jeff, I have a question for you. Let's say that I am listening to this podcast and I'm trying to decide how I'm going to broach these ideas with my partner because he or she is not listening to the podcast. Let's talk about that. Let's talk about inviting the partner to join you in this new sexual space. You go first and then I'll go.
Well, first off, I think that we spend a lot of time talking about how to talk about sex, and the reason is because with our patients, and I have my patients talk about it, and I say, okay, like you said earlier, Susan, which is a super good point. In the middle of sex is not a time to start rating, criticizing, talking about I need you to move here and do this and do, because that can be perceived as criticism or control and uncomfortable sometimes. But I think the more we learn to talk about sex, especially outside the bedroom, the more comfortable we become with talking about sex and bringing up these subjects. And so I think it's vitally important to begin the conversations, because here's the extent of our how we know how to talk about sex. Yes, whatever. Those are not sentences. We need to have formed sentences about what we need and what we want. Every human body is responsible for our own orgasm. Mm-hmm. You need to be able to express to your partner some of your needs and wants. So I think it's really important to use I language. I feel this, when this occurs, I really need this from you. I think that's a great way to do it. I think you can have fun with it. You can say, let's have a great conversation about fantasies right now, sexual fantasies. Let's unpack those with each other. But begin talking about it, because the more you talk about it, the easier it becomes to talk about it. But because we don't talk about it in general, I think about it like did you have really in-depth conversations about sex with your husband? Would that be something that would normally just happen when there's no problems, everything's good, everything's working? Most people would say, no, we don't talk about it. No. We don't talk about it. And we teach it, Susan and I, and Julie and I. We did some discovery in the beginning, different things like that, but we didn't have those conversations. When you end up having those conversations, usually is when they're more uncomfortable because something's wrong or something's challenging and you need to bring it up. And you want to approach that with the greatest love. So that would be the things I'd say. But what a great topic is learning to talk about and communicate about sex.
Yeah, absolutely.
What do you do? What do you think?
Well, when people, again, when we talk about we don't have language, I ask patients, I ask friends, like, again, how do you know you're about to have sex? There's a lot of nonverbals. There's also the really obscure verbals, like, how about we get busy? let's go take a nap. I mean, like, meeting upstairs. There's a
Mhm.
lot of this, but we don't ever say, I'm not going to own this one because my husband does say this, but he says, would you like to make love with me?
Oh, that's so
It's a
nice,
lovely
though.
invitation. If I was Jeff, if I was asking you to go to lunch, I could say, you want to have a hot dog? But I was like, Jeff, how about if you join me for lunch today? Isn't that just a lovely invitation? It makes you inclined
Yes.
to say, yes, I'd love to. Thank you. So I
Mhm.
think really just use the words. Would you like, if you want to use the F word, do that. But would you like to blank with me? And then the scheduling takes a lot of this pressure off, because if you have a scheduled time, in our practice, we call it sacred time, a time just to be alone together. It doesn't mean there's any penis in any vagina invited at all. But what it does mean is it's a time for you to have scheduled time alone, without the TV on, without your phones on. I ask patients to arrive for sacred time clean, because I think you're more inclined to put a mouth somewhere or a hand somewhere or anything somewhere when you know that it's a clean space, and you feel more sexy when you're clean. So they do that, and sacred time could just be 20 minutes literally 20 minutes once a week, but it's a time that's dedicated for that purpose, for the purpose of exploring. So if sacred time is already established, then patients can say, how about we use sacred time this week to do handwriting? How about we use sacred time this week to masturbate in front of each other? I mean, that is a completely foreign concept to many, many couples, and they feel
Mhm.
very, very uncomfortable about it. But
Mhm.
it's like you said, it's your body, you own your body. And so showing your partner how you pleasure your body can be a really, really growth producing experience. And that's another way that people play, is they actually touch themselves. They don't have to rely on their partner to do all the work, but they include their partner either watching or in a spoon. Like when you said the spoon technique, that's a great place when you're spooning, if you're going to sell pleasure because you don't feel like you're on stage, the partner's holding you and can literally hold you while you come to orgasm, which is
Mhm.
thrilling if you've never done
Mhm.
that before. It's almost like being a voyeur, because you're like
Mhm.
you're like just kind of on the outside, but a very, very exciting thing to share.
I mean, just spooning is such a wonderful thing anyway. Now, think about you're having an orgasm while you're spooning, and that can be a really wonderful thing. And I know all of you are probably like, but I'm self conscious. Okay. The most beautiful people in the world are all self conscious too. Make no mistake. You think it's just you, but it's everybody. It really is.
Mhm.
And so that's such a good thing you brought up, because like I had a patient with cancer. She's like, I can't do anything. It's uncomfortable, anything down, but I want him to feel free to do it. And I would love for him to do it in front of me. And so we worked on exactly that, them working on at home with him masturbating and her holding him
Yeah,
and helping. And she's like, oh my God, this was so amazing. I felt more intimate with him than when we were having intercourse, because it was such an intimate, wonderful moment for both of us when he was basically masturbating with her, holding on to him,
yeah.
and being a part of it, a complete part of it.
It is. And again, that's a great outer course technique that I don't know that is always on the top of people's hit list, but it's really, really intimate. Okay, I have another one for you. How about this
Yay.
one? So let's say that you're not in, for whatever reason, you're either new to or not into dominance and submission play, where one person really takes charge and is more dominant, and the other one is more submissive and giving in along the way. One of the ways to kind of play with this just a little bit is simple act of using sleep masks. You know, that masks that you put on the plane to get some sleep. You know what I'm talking about?
Hmm.
Well, sleep masks can double as blindfolds, newsflash, so that you can actually have play with your partner and decide who is going to be blindfolded, therefore submissive, if you will, and who is going to be full sighted. And oftentimes, it's really, really curious. I ask patients to do this all the time, and they can use it for the other kind of penetrative play if they want, or they can use it for some of these outer course techniques that we're talking about. But it forces the person who's blindfolded to really feel the feelings, the sensations. You talked about the taste, the sounds, the sensations, and not be looking around the room, checking the clock, being in their everyday life. It takes a person completely out of that space while they're blindfolded. And the self-consciousness that you spoke of a few moments ago, people feel a little bit less self-conscious too when they're blindfolded, because they're just don't feel so exposed. Because when your eyes are covered, you don't feel as exposed, even if you don't have a lot of clothing on.
Mm-hmm.
The person who is pleasuring the person who is blindfolded also feels a tremendous amount of decreased self-consciousness, because they can explore and really look and not worry about anything. I mean, they just really they can say, oh, I never noticed that hair starts there. And, and they can touch a skin sensation. And the person who's blindfolded just kind of goes with it. And the person who is stimulating them doesn't even really have to, they could do something completely different or something that they always do, but it feels and it's shaped differently when one person is blindfolded. And I very much encourage partners to switch who's wearing the blindfold, obviously. Like in one session, you wear the blindfold, next time I will. And you've set up ground rules, obviously, but there has to be trust between partners when they're blindfolded. But it's a sleep mask, for goodness sake. This is not whips and chains. It's a sleep mask, okay? But it's a great, great way to just change up a little bit what sex play looks and feels like in a very simple way. Just pop on a sleep mask and don't cheat. Look underneath.
Yes, I love it. I love it. And you know what would be fun too? Maybe get a little set of essential oils or smells or something. And while the masks are on, maybe both of you kind of put your masks on for a minute before you start and be like, what's your favorite scent? What kind of turns you on? What gets you going through the nose a little bit? And then use that throughout the love play. Then take your mask off and that partner use their favorite smell or scent or aromatherapy. Because I think our other senses are more powerful when we dull one by masking. So I love that idea. And I think there could be some fun things happening with touch and smell and other things.
Absolutely. Another thing you can do with that technique is the person who is blindfolded is kissed on any and every part of their body except nipples, genitals, and mouth. So take off the three leading places we get kissed. Take it off the menu, put a mask on, and then the person who's stimulating them is just going to kiss them. Just put a kiss here, put a kiss here, put a kiss all over. And again, off the table, mouth is breast, genitals, anus, obviously, and then mouth. And just see what feels good. And the anticipation of the kiss coming and not knowing where it's going to be, but feeling secure that if you're feeling, it's not going to be any place too scary for you. Very, very, very titillating exercise. Very exciting exercise for both people in the couple. So.
I love it. That's great. That's really, really good. Let me give you some questions that have come up. Let's see.
Okay.
I have one question that had come up, which was, why do you think society places so much emphasis on penetrative sex as the ultimate form of intimacy?
So part of this goes back to our puritanical and or religious roots. And we're not the only culture that feels this way, by the way. This is a construct that's quite accepted through many cultures of the world. And it probably started with the act of penis and vagina penetrative sex to produce another generation or an heir to your family or another generation. So it was legitimized, you see, for its non-titillating factor, for its utilitarian factor, that it can bring on a new life. It can bring about a new life. And there are some cultures in this world that it has to be done as fast as possible. Just really like as absolutely as fast as possible needs to be done. There are other cultures of the world where it has to be done as silent as absolutely, not a squeak, not a moan, not a groan, not a squeak. There are some cultures of the world that really they de-emphasize the sensuality part of it. It's just the mechanics of penis and vagina. The other thing is, if you think of the words we use, Jeff, the words we actually use in our industry, penetrative sex, it infers that someone is penetrating. Okay, so it's a little bit male-oriented, okay? So there's a male penetrating, and that the female is really not taking part in it, but just receiving. And it's not called engulfing sex now, is it? So if it was engulfing sex, I, as a woman, would be engulfing the partner I'm with. And so that would be a very much a female oriented perspective. But our perspective tends to be a very male oriented perspective when we use things like the word penetration. So I prefer to say love play or sex play rather than penetration, because it really is. It's really a thing where two people come together, male, female, male, female, any way you want to look at that, but where they come together, hopefully in a consensual way, for the purpose of sharing and exchanging pleasure. They're sharing and explain and sharing things that will result in a baby. That's lovely, but it isn't necessary anymore for how we view intercourse as the gold standard. What are your thoughts on that?
No, I agree wholeheartedly. And I do think that when it's not procreation, when we're thinking about why are the reasons, and you look into the research, why are people, what are the purposes of sex? Pleasure is one of them, of course, at the top of the list. And in loving relationship, connection, deeper connection is the other piece of it that I think. So I tell people, okay, if you had a really good time and you felt deeply connected, you can tick the box that you definitely did everything you set out to do with this love play experience. And maybe you did that at a restaurant where you fed each other and it had nothing to do. I heard you talk about, and I talk a lot about, using Masters and Johnson's research-based sensate focus. We take things off the table like intercourse. Why would we do that? It removes all the pressure. Nobody has to be a certain hardness when we don't have to have penetration or intercourse or anything like that. When we remove some of these things off the table, it frees people to have deeper, greater love play, and it removes the pressure. You also talked about remove the genitals, remove the breast, sometimes because those are our go-tos. And we find wonderful things happen, miraculous things happen when we let go of those things. And we find out, oh my gosh, the back of my ear is like the craziest place, or whatever.
How about my back right there?
Yeah, right. Whatever, right? This place on my inner thigh drives me insane. But you will never discover those things if we don't do things like take some of that stuff off the table. And so, the things we're recommending too, they are based in science. They're scientifically proven. So realize that Masters and Johnson did this amazing research that we'll never do again because they paid people to have sex in front of them. And it's not even possible with research these days, but they learned incredible things from that. People from masturbating, from having sex in front of them. And so I do think sometimes it's really helpful to take off some of those go-to things like the genitals, penetrating whatever. And again, penetrating it may not seem as reciprocal because it's someone's being penetrated and someone's not. So I love the words love play too. I think that's a great way to describe it. I do have one other question for you that came up, and that is, what role does sensory exploration, I think we've talked about this a fair amount already too, such as touch, temperature play, and sensation play in Outercourse?
Well, kind of plays, it's very much a time to explore all your senses when you're having Outercourse play, because the kind of the expectations of, oh, this is when my vagina gets wet, this is when I get penetrated, those are gone. And especially if you're doing things where you're exploring each other's bodies in ways you've never done it before, it's like, wait, what is that? What does that feel on my inner thigh? What is that sensation I'm feeling? What about, Jeff, if we took an ice cube during that and put the ice cube on your inner thigh? It would be very cold, I'd like to point out, but it would be a new sensation for that inner thigh, wouldn't it? One that is not kind of in everyday life. Or maybe to your point with this essential oils, what if while you had your ice cube there, you smelled strawberries? Your mind would probably blow up. It would be really, kind of setting off like fireworks of sensations. And like, this is so mind blowing, kind of like the 4th of July at your house every day. So So
Oh, and it's like, don't we all want that with sex? So I love all these ideas. They're so good, Susan. And the thing is it's like just like that. You think fireworks, mind blowing. Is this sounding pretty good to some of you out there? I think so. So you can have a wonderful time. Um, why don't you give us another uh, two more really good outer course ideas, and then I'll go to our closing after that, because there's so many. We could do this all night long. But
we could do it all night long. Okay. I mean, yeah, excuse the pun there. But anyway, okay. So
everything you say, double entendre here.
I've got one called texture night. So texture night is also, it's one person has to have their eyes closed or blindfolded, but doesn't cheat. And the other person has a whole array of textures in front of them, like household things, like a piece of leather, a piece of vinyl, an ice cube if you want, a feather. A feather would be really soft. The things, I'm a cook and I know you are too. So those little brushes that you put butter on a turkey with, they're like, do you know what I'm saying? So that's one. So things that a cotton ball would be one, a little, like a non-ink ballpoint pen, but just the end of the pen. So different textures, some sharp, some soft, some wet, some hot, some cold. Anyway, and the patient or the person knows that they're going to be feeling textures, but they don't know what's coming next, where it's going to be placed. And then you can really make it kind of fun and see if they can guess what they're being stroked with. I had an older couple that wanted to rekindle sexual play, and neither of them could in any way, shape, or form have genital play, not at all. And no kind of genital play. It would go nowhere. Let's put it that way. So they loved playing with basters, the really soft brushes. And they used to, the other thing is she found great offense with the roughness of his hands that were calloused from working. And she found that was so offensive on her skin. So this soft brush, pretend he was based in the turkey. So the soft brush, it was incredibly arousing for her. Incredibly arousing for her. And who knew? Who knew that was going to take her to the highest height of ecstasy during their play? So yeah, crazy, huh?
That's so great. And we've both done this long enough that exactly what you said. I have had definitely partners say, their fingers are too coarse. It just doesn't feel good because they're too coarse. So you try different types of, different types of oils, lotions, things that are, explore all the different things. Maybe try a glove or try something, try different things that might be kind of fun I love the texture idea. I think that's such a great idea. And I have had a lot of patients talk about their partner, male, female, whatever. They didn't like the feel of their fingertip or something. So don't use your fingertip necessarily. Try something different. Love it.
The other thing is when there's something annoying in the sexual play, it can really disrupt the train of arousal. And so if a breath, for instance, is unpleasant, suck on a mint, for goodness sake, when you're talking in somebody's ear or something like that. Again, with handwriting, which you're usually using is your own hand. But again, if their touch is too strong, and they just can't get it, don't try to change somebody so much. Just give them another instrument to use. Like that's why the brush works so well. First of all, we worked for weeks on softening and doing round circles, and it wasn't happening. So we came up with the brushes, and it was fantastic. So
they could have like a little symphony of different brushes to try, even, or different feathers or whatever. How fun!
Yeah, exactly. All right, you want one more? I'll give you one more. Okay.
Yes, one more.
Let's see. Handwriting we did. Bye-bye. Okay, when your partner is this is a little mean, but it's kind of fun. Okay, when your partner is very, very, very highly aroused. So for whatever got them there, God bless them. They're all very aroused. Sprinkle water on their arousal parts, whether it's nipples or genitals or penises. Sprinkle ice cold water. Break the moment. That's like edging. It's a variation on the edging because it causes everything to get reset and then begin stimulation again. And that's a really fun way to edge, but you have to know the water's coming. I mean, you don't know exactly when it's coming, but it's really cold. But it's just so I don't know. It's a new texture. It's a new sensation. It can be really, really erotic.
It's like a reset for sure.
Yeah.
It's like a reset. How fun. I mean, gosh, it's just, both of us, it's such an honor and a privilege to that how patients let us into these very private worlds. And we've had the opportunity to do that. And your private world is your own private world. But if you start talking to your partner, it makes such a difference. You brought up so many excellent points, lots of good ideas. We honestly, when we talked before the show, she has 30 things she could have talked about tonight in terms of what you could do for Outercourse. There's so many things that you could do in terms of Outercourse, all kinds of different stimulations and things that you could do. That's for sure. So I just thank you so much for joining me. And Dr. Kellogg's, she's going to be pretty much a regular, coming on fairly regularly because she has so much good things to teach us. And so I'm so happy that you were here and taught us about Outercourse.
My pleasure.
Love play, beyond all those things. And I think it's really exciting. So we are going to go to a little bit of a closing to kind of center us a little bit like we always do. So as we do at this point in the podcast, I would like you to take a moment to pause. I'd like you to settle into a comfortable position for yourself. If you're able, gently close your eyes. Now take a slow, deep breath in from your abdomen. Breathe in and fill your lungs slowly for several counts, and exhale fully and continue that deep, slow breathing pattern for me. Let the tension in your body melt away, releasing everything that no longer serves you. Bring your awareness to this moment right here. Bring your awareness to the now. How does it feel? What sensations ground you in here and now, the present? Allow yourself to fully embrace and immerse yourself in this present space, without resistance, without expectations. Stop doing. Just be. Just being. As you continue to breathe deeply, hold this thought in your heart. This moment is all I have, and it is enough. What is unfolding now is exactly what I need to experience. I embrace where I am fully and without judgment. I welcome what is before me with openness, joy, and curiosity. Take one last deep breath in and slowly exhale. And when you're ready, gently open your eyes and carry those intentions forward with you. I am so honored and pleased you were here with me this evening, and I hope you learned some amazing things, because I sure did, and it was great. And also, let's, Vic, can you give them a glimpse of what's up next week?
Premature ejaculation is a common yet often misunderstood condition that can affect confidence, intimacy, and relationship satisfaction. In this episode, Dr. Jeff is joined by renowned psychologist Dr. Stanley Altoff to explore the underlying causes, debunk common myths, and discuss effective treatment options. Together, they provide evidence-based insights and practical strategies to help men and their partners address this sensitive issue, fostering greater understanding and enhancing sexual satisfaction. Join us April 1st at 7 p.m. Central Time to learn more.
Well, it has been an awesome evening. And I'm telling you, I don't know about you, but I think the possibilities are endless if we're open to them.
Absolutely.
Thank you so much for joining me, all of you. And thank you to my special guest, Dr. Susan Kellogg-Spadt. And have a great evening, everybody.
Thanks,
or a great day.
Good night.